In Chapter 7, know what primary and secondary or tertiary prevention is, and also know what the examples are that are given in the book. Know which is the most commonly used substance by adolescents, and when that use is more likely to turn into substance dependence. Be able to identify the personal and social influences that can promote adolescent alcohol use, as well as the effect that adult supervision and youth programs can have on rates of adolescent drug and alcohol use. Intervention requires a presentation of reality to the chemically dependent person. Know what the presentation format should include, as well as how facts should be presented, and the role of the significant persons in providing that information to the subject of the intervention. Able to identify denial and enabling. For example, the indicated patient is likely to minimize the addictive condition. Understand the components of the formal intervention program developed by the Johnson Institute, and be able to identify what goes on in the general education session, the family intervention class, and the pre- and post-intervention sessions. Know the history of EAPs and how they were addressed in the Big Book. Know about the different types of EAPs and how private industry saw the benefits of creating EAP programs for their employees. Be able to identify a broad brush program as well as the biggest hurdle to the use of an EAP by an employee. Know the chronology of the Washingtonians, the Oxford Group, and AA. For example, the Washingtonians were organized about 1839, and the Oxford Group was organized in the 1920s. Know about 12-step programs. 12 steps, 12 traditions, questions and misconceptions about 12-step programs, and understand the 4 psychological processes of a 12-step program. And understand that group treatment has been recognized as a therapeutic and economical method of helping difficult-to-treat patients. Know how disease is defined. Know the differences between acute, chronic, malignant, and benign. Know what goes on in the different stages of addiction. Know how the DSM classifies substance abuse, and know how ASAM defines alcoholism. Know what drugs do to the central nervous system, and know how each major class of drugs impacts the central nervous system. For example, hallucinogens distort sensory perception and disrupt the functioning of the CNS. And know how common drugs of abuse impact the central nervous system. For example, alcohol is a depressant, cocaine is a stimulant. Understand the general trends in drug use and abuse. For example, in metropolitan areas, drug abuse deaths occurred at the highest rate for which group? And understand the use of other drugs such as heroin, cocaine, ecstasy, and other club drugs. Understand the general characteristics of medications, and understand the treatments for specific clinical syndromes. For example, what does antabuse do? You should know the meaning of common prescription abbreviations, as well as the common side effects of common prescription medication. You should also be able to identify the common terms and types of treatment associated with holistic approaches to recovery, such as acupuncture, chiropractic, and hypnotherapy. Know what FAS is, as well as its consequences. Understand the differences between the various prevention strategies. For example, selective prevention would target women who are at greater risk for having children with FAS. Know the characteristics of hepatitis, as well as the correlation between alcohol abuse and the increased incidence of high-risk sexual behaviors in contracting HIV. Know the incidence of death and increased cost to employers from cigarette smoking, as well as what nicotine does physically to a person and associated diseases. Know whether eating disorders generally co-occur with alcohol and other drug use disorders. Know the general characteristics of those eating disorders. Know whether there may be a genetic vulnerability to pathological gambling, as well as the 10 identified behaviors listed in the DSM-4 that relate to a gambling disorder. And know that studies of gambling problems among those in treatment for substance dependence have consistently yielded rates well above those in the general population. Know the characteristics of an individual with sex addiction. Know the concerns commonly encountered during a sexual addiction intervention, such as sexual abuse, drug and alcohol abuse, physical abuse. Know the characteristics of a codependent individual. The treatment works best when it is treated as a primary or secondary disorder. Know about internet addiction and the group most susceptible to this addiction. Know about dual diagnosis, about its most common symptom, and know what should be included in discharge planning for a dual diagnosis client.